my name is Brian Casey, and we are here at RSNA 2022 in Chicago. We have with us right now Daniel Mollura. He is founder and CEO of RAD-Aid. Daniel, thanks for being with us.
Thanks, Brian. Thanks for having me.
Yeah. So can you tell us a little bit about RAD-Aid and what your mission is?
Yeah, so RAD-Aid is a nonprofit organization. It's charitable as a non-governmental organization that helps low-resource hospitals to build radiology capabilities through education, equipment donation, and support for clinical care. We also work in medically underserved areas of high-income countries. So we've been around for about 14 years now. We started the organization in 2008, and it's grown. It now serves about 44 countries, 91 hospitals. There's about 15,000 members who are all medical imaging and rad-onc specialists, whether they're nurses, technologists, MDs, physicists, IT personnel, so across the radiology industry that have worked with us to really help low-resource hospitals to build better radiology services for their patients.
Great. And so access to imaging is kind of your mantra.
Yes, yeah, because half to two-thirds of the world don't have access to medical imaging and radiology. And what that does is it means it has a ripple effect. So anything throughout medical care that uses imaging for diagnosis or screening or treatment, basically when it's absent, it's a ripple effect across their healthcare system. So if you're using imaging for infectious disease or trauma or cancer or screenings, the absence of the imaging basically means you have a hole in the entire care pathways in those countries. So by RAD-Aid helping low-resource hospitals to develop better resources and access for their patients, it affects the entire healthcare delivery system.
Now, what sort of activities are you involved in? What sort of general themes are you seeing in the work that you're doing?
Yeah, so it's amazing the way, as technology advances, radiology is never static, as you know. Yeah. And so as technologies advance, we can do more and better things for low-resource hospitals. So one of the things we're seeing a lot of is what is the uses of artificial intelligence in being able to help low-resource hospitals. Turns out that most hospitals don't really even have PACS yet. So as a result, we've been doing a lot of IT system implementations for low-resource hospitals, such as cloud and PACS, and as well as delivering artificial intelligence and education packages so that personnel can learn these technologies as they develop them. So AI and cloud is definitely a big theme that we're seeing. A second theme is equipment donation. More hospitals are adopting CT and MRI, but there's not as much development of the ecosystem to support broken equipment. So if there's malfunctions or repair that's needed, that's not as well developed. So we're supporting those hospitals to make sure that they're getting maintenance contracts and other forms of biomedical engineering service support. I think a third theme, we're seeing a lot is just, basic education. They need more personnel for helping their patients. So in some countries, we're supporting a lot of residencies, such as in Guyana, we actually helped start a residency program. And in other countries, we're supporting residencies that are training, the newer radiologists that are coming into the profession there. So, I think these are some of the common themes that we're seeing.
Okay. What can folks do to support RAD-Aid?
Well, one of the things is just to volunteer and get involved. On our website, they can find links and applications. And when they volunteer or apply to RAD-Aid, we ask some questions about, where have you been before? What languages do you speak? Or what clinical area of radiology are you in? And what we do then is we match those expertise and interests to certain projects if they'd like to get involved. So if someone would really like to go to Tanzania or something, we can flag that and say, okay, let's have our Tanzania program manager reach out to them. If on the other hand, maybe they don't have a preference for where they would go, but maybe they want to do interventional radiology, they can flag that and we can say, okay, here are the IR projects that are available to people of your background that would like to get involved and help hospitals do more IR.
Awesome. And where can people go to get more information?
That's radaid.org, so rad-aid.org.
Awesome. Well, hope people will go and do that. Dan,
Yes.
thanks for being with us today.
All right, thanks, Brian.
Signing off from RSNA 2022, my name is Brian Casey.